Gout is a common, painful form of arthritis. It causes swollen, red, hot, and stiff joints. Gout is caused by increased production of uric acid. Uric acid crystals travel and accumulate in the joints, especially in the feet and legs, causing great pain and swelling. Osteoarthritis is the most common form of arthritis and is associated with the aging process. Even from the outside, you can see that the knee of an older person looks considerably different than that of a younger person. Let's take a look at the joint itself to see the differences. Osteoarthritis is a chronic disease, a disease that persists for a long time. It causes the deterioration of the cartilage within a joint. For most people, the cause of osteoarthritis is unknown, but metabolic, genetic, chemical, and mechanical factors play a role in its development. Symptoms of osteoarthritis include loss of flexibility, limited movement, and pain and swelling within the joint. The condition results from injury to the cartilage, which normally absorbs stress and covers the bones, so they can move smoothly. The cartilage of the affected joint is roughened and becomes worn down. As the disease progresses, the cartilage becomes completely worn down and the bone rubs on bone. Bony spurs usually develop around the margins of the joint. Part of the pain results from these bone spurs, which can restrict the joint's movement as well. An elderly woman had to be taken to the hospital last night. While getting out of the tub, she had a fall and broke her head. An elderly woman had to be taken to the hospital last night. While getting out of the tub, she had a fall and broke her head. An elderly woman had to be taken to the hospital. Because her bones are so fragile, the woman probably broke her hip first, which then caused her to fall. Like millions of people, the woman suffers from osteoporosis, a condition that leads to loss of bone mass. From the outside, osteoporotic bone is shaped like normal bone, but the inside appearance of the bone is quite different. As people age, the inside of the bones becomes more porous due to the loss of calcium and phosphate. The loss of these minerals makes the bones more prone to fracture, even during routine activities like walking, standing, or bathing. Many times, a person will sustain a fracture before becoming aware of the presence of the disease. Prevention is the best measure for treating osteoporosis by eating a recommended balanced diet, including foods with sufficient amounts of calcium, phosphorus, and vitamin D. In addition, maintaining a regular exercise program as approved by a qualified healthcare professional will help to keep the bones strong. Various medications can be used as part of the treatment for osteoporosis and should be discussed with a qualified healthcare professional.